In this next recording, we're going to look at what happens when we give an IV bolus of norepinephrine in the presence of a consistent infusion of phentolamine. So remember, norepinephrine is an agonist of alpha-1, alpha-2, and beta-1 receptors, and phentolamine is an antagonist of alpha-1 and alpha-2 adrenoceptors. We'll begin by drawing our diastolic pressure, our systolic pressure, our mean arterial pressure, and also our heart rate on this tracing. Phentolamine is already on board at the point where these measurements are started, so our alpha-1 and alpha-2 receptors are already blocked at this point. Norepinephrine gets administered at the purple arrow, and its effects on alpha-1 and alpha-2 receptors are already blocked by the phentolamine, which is already present. So, as expected, norepinephrine can't produce its ordinarily expected increase in diastolic pressure because the alpha-1 adrenoceptors are blocked. We do see an increase in systolic pressure because norepinephrine is still able to stimulate beta-1 receptors in the heart, increasing heart rate as well as contractility. This increase in contractility is seen by the increase in pulse pressure that occurs. That indicates the beta-1 effect. The mean arterial pressure increases as well, and you can see that all of these measurements return to baseline as the norepinephrine is removed from our body. Now, the mean arterial pressure is increasing. This is going to initiate some reflex responses. A decrease in sympathetic outflow will occur, which would ordinarily decrease norepinephrine release, therefore decrease the heart rate and decrease the contractility. However, we have norepinephrine on board, which has been added exogenously, and so this really pretty much overwhelms the effect of the decrease in norepinephrine that we would see because our sympathetic nervous system is less active. We also see an increase in parasympathetic activity, release of acetylcholine. This release of acetylcholine will slow the heart rate. Remember, no effect on the contractility, but it will slow the heart rate somewhat, so it kind of attenuates the effect of norepinephrine on heart rate. So you'll see an increase in the heart rate probably, but not as much as just the straight up beta-1 stimulation would be expected to produce.